Hello everyone, so in this video we'll discuss how the smoking can harm our organs and specifically focusing in our respiratory and cardiovascular system. As we know that the cigarette or the smoking, it's not just harmful, it can lead to more serious health complications including death. So let's start by what makes up the cigarette. What makes up cigarette? So basically the cigarette, it contains dry tobacco, which is come from the tobacco plant. And the tobacco, basically it contains substance it called the nicotine. Basically the nicotine is addictive substance. So when you smoke, this nicotine, it will move or absorb throughout the bloodstream and reach to the brain. So basically it affects the nervous system, it affects our nervous system. Additionally, the cigarette, when it burns, basically, or the tobacco, it burns, it releases like harmful chemicals or harmful uh, substance, okay, harmful gases such as carbon monoxide, or for example, we have also ammonia and many other gases that basically harm or damage our tissues, our organs, and over time lead to the impairment of the organs. So after a few seconds, I will show you some specific diseases, chronic diseases that affect basically our lung and our heart. Okay guys, so as we see in this picture, we have here something called the cilia. Basically the cilia, we can find it in our lung, we can find it in our respiratory system, and the cilia, it's just tiny hair-like structure. This cilia, or the major function of the cilia, to remove the mucus from the lung, to remove the toxin, and also to remove the germs from our lungs. In the case of the tobacco smoking, as we mentioned before, we have like a harmful substance or harmful gases from the smoking, and these gases, it will enter over time and lead to the damage or harm these cilia. So basically the smokers have a specific cough. It's called basically the cough with mucus or chronic mucus cough, because their body start to normally because the cilia, it's damaged, right? So their body start to remove these mucus from the lung. Over time, they have this mucus, it accumulated in the lung, and they basically in the high risk to get infection and inflammation, chronic infections of the lung. And basically we have something called the COPD, and basically I will show you what is the COPD now. Okay guys, here we have like additional important information. So basically when you smoke, we have the gas that we mentioned before, the carbon monoxide. The carbon monoxide, it's enter, okay, through your mouth and through the respiratory system, enter to the lung, right? So here we have something called the alveoli. So the alveoli, we mentioned before, it's for the gas exchange. So basically when we breathe in the oxygen, it will enter to our body. When we breathe out, the carbon dioxide is basically leaking out, okay? So in the case of the smoking, we have something called the carbon monoxide. So the carbon monoxide, it enter to the lung, enter to the alveoli, and basically it bind to the hemoglobin, which is and as we know, the hemoglobin, it's basically in our red blood cells. So this carbon monoxide, it's entered to the blood, bind to the hemoglobin, okay, enter to the red blood cells, and reduce the ability of the red blood cells to taking the oxygen. So the patient will have low oxygen, and the patient will have basically carbon monoxide in the blood, okay? While as we know, we should have oxygen to basically this oxygen move into our organs, and our organs can working probably. So in this case, the patient will have low oxygen, and the patient will have carbon monoxide instead of the oxygen. So the patient will have less oxygen, and the patient will have difficulties of the breathing. Okay, guys, so here we have something called the COPD. Basically, the COPD, it's the chronic obstructive pulmonary diseases. So basically, pulmonary, it refers to the lung, and we have two types of the diseases here. So the first type here, we have something called the chronic bronchitis. So what is chronic bronchitis? As we see in this picture, here guys, we have the bronchi. So this is the normal bronchi. This is the bronchi in this picture. We can find it here. And then we have the bronchioles, the smaller one, and then we have the alveoli, okay? So this is the normal bronchi. When the gases or chemical come from the smoking, it basically irritates and inflames these bronchi, this normal bronchi. And over time, the patient will develop chronic bronchitis, okay? So the chronic bronchitis, when the patient have a persistent cough, okay, due to the accumulation of the mucus, the patient will have like a mucus, okay, excess production of the mucus in the bronchi, and the patient will have persistent cough, okay, persistent cough, and basically, especially this cough, it's with mucus, and the patient will have a difficult of the breathing because here we have excess production of the mucus. So this is the first type of the COPD. Okay, guys, so the second type of the chronic obstructive pulmonary disease, we have the emphysema here. So the emphysema, as we see in this picture, this is the normal alveoli, okay? So the alveoli, this is the part of the lung which is responsible of the gas exchange, exchange of the oxygen and carbon dioxide. In the case of the emphysema, we have basically a damage of the alveoli, okay? So when you smoke, these chemicals damage the wall of the alveoli, and this is lead to the alveoli to lose their elasticity and lose their shape. So the lung can't basically expand and work and contract probably, okay? So the patient with emphysema, basically, they have a difficult to taking a deep breath, and they have difficulty in the breathing. And the problem of emphysema, it's basically a progressive disease. Okay, guys, so now I will move to another point, how the smoking can harm our cardiovascular system. So, how the smoking can harm our heart. So, normally, every organ need oxygenated blood, okay, to working well. We have here a blood vessel called the coronary artery. The coronary artery supply our heart by oxygenated blood, okay? In the case of the smoking, what will happen? In the case of the smoking, so let's imagine that this is the coronary artery, okay? In the case of the smoking, the chemicals which is come from the smoking, it will irritate the lining of these blood vessels, okay? It will irritate or damages this lining, and now it's making it easier for this area, okay, uh, to deposit the fat. So now we will have a deposition of the fats here, okay? It's called this process atherosclerosis. So there is atherosclerosis when we have a narrow area for the blood supply, okay, due to the fat deposition, and we have thick of the blood vessel, okay, due to the fat deposition. Now we will have a deposition of the fat, and over time this deposition will accumulate, and basically lead to the less blood flow to the heart. When we have narrow area, more than like 50-70%, okay, the patient will have here less blood flow to the heart, and this is the definition of the angina. So basically, angina is when the patient have less blood flow to the heart due to the atherosclerosis, which is the fat deposition more than 70%. And if the angina basically it's not treated, okay, when the angina it's not, if it's not treated, it can lead to more serious condition, heart attack. Okay, guys, so as I mentioned now, if this angina it's not treated, it can move to the more serious condition, to the heart attack. And basically, briefly, what is heart attack? heart attack, it basically when the patient have full blockage of the coronary artery. So now if there is like deposition of the fats, okay, full deposition like 100%, the patient will have heart attack, okay, because there is no blood supply to the heart. So this is the definition, simply definition of the heart attack, okay. So the smoking basically it's lead to the more serious condition, can lead to the heart attack. If, for example, if there is a deposition of the fats, it can lead to the angina, and this angina, if it's not treated, can lead to the heart attack. Okay guys, so now how the smoking also can affecting our DNA. So basically in this picture we have the DNA, and as we know normally the DNA we can find it in our cells. Basically the DNA it had many function, okay, important function for our body. But basically the also we have the major function here, which is replicating of the cells, right? So the DNA is responsible of the replicating the cells for the normal growth and correct growth of the cells. In the case of the smoking, okay, we have also in the case of the smoking, okay, we have chemicals, okay, harmful chemicals, okay, which is carcinogens, okay. So these chemicals, it can affect our DNA. How it can affect the DNA? It basically like change the shape of the DNA, okay, the correct shape of the DNA. It can lead to the mutation is basically meaning that the change, okay, of the structure of the DNA, and this mutation, okay, can lead to the change of the shape and the structure of the DNA. Basically we have a normal mechanism in our body. It's called the DNA repair mechanism. This happened to fix the damages that happen in the DNA. But if the DNA is like every time exposed to the chemicals, harmful chemicals, the our body cannot basically or does not have the ability to repair these damages, okay, and this can lead to the abnormal growth of the cells, abnormal replicating of the cells, and this basically can lead to the cancers. So the most common cancer is the lung cancer, which is about 85%. And we have also another, the smoking can lead to another type of the cancers, like mouth cancer, can lead to the throat cancers, other parts of the body organs like cancers. So basically the quitting of the smoking, it's very important and essential thing, and every smoker should basically start to quit smoking. Because basically according to the WHO, which is World Health Organization, the smoking is responsible of the more than 8 million deaths each year globally. So basically the smoking, it's a harmful thing. Okay guys, so here we have additional information. As we mentioned, we have something called the nicotine, which is the main substance in the tobacco. Okay, so the nicotine is within like 10 seconds, it will absorb through the bloodstream and enter our brain. So it will enter to the nervous system, right? So it will stimulate, when it enters to the nervous system, it will stimulate a hormone called the adrenaline hormone, which is also called the epinephrine, okay? This hormone, when the nicotine is stimulated, this hormone will increase the heart rate and also increase the blood pressure. So basically, why the blood pressure it will increase? Because it will constrict the our blood vessel. So cause of that, the smokers will have, after smoking, have increase in the heart rate and increase in the blood pressure. So now, guys, we discussed a lot of things. How the smoking can affect our organs, and specifically focusing on the respiratory and cardiovascular system. It can lead to the angina, as we mentioned, if it is not treated, heart attack. Also, how it can lead to the mutations in the DNA, and basically how it can lead to the chronic pulmonary obstructive diseases. And also, we mentioned that it can lead to the increase in the heart rate and blood pressure. And basically, quitting of the smoking, it's very important because it will reduce the risk of these issues.